Well, welcome to the Washington State Potato Commission Zoom discussion on reducing COVID spread among employees on your operations. I am Matthew Blua, the Director of Industry Outreach with Washington State Potato Commission. And I just want to point out that we are not epidemiologists. The panel that will discuss these things are not epidemiologists or COVID-19 experts. But we spent some time getting some information about these things. And if you have questions things that we didn't cover towards the end of our session, go ahead and use the chat function on Zoom to type in your questions. And if you hover with your cursor at the bottom of your Zoom window, you will see a chat function. You can type your questions into it. I'd like to introduce the panel to you. First, we have Faith Critzer. Wave, Faith. Faith Critzer is a Washington State University Associate Professor and Produce Safety Extension Specialist at Prosser. We have David Conley. David, wave. Thank you. David is a Regional Consultation Manager with the Washington State Department of Labor and Industries. We have Marcin Topolewski. Marvin, wave to the crowd. Marcin, rather, wave to the crowd. Marcin is the Food Safety Director at Basin Gold. We have Carrie Wohleb. Thank you, Carrie. Carrie is a Washington State University Vegetable Crops Specialist. And we have Tim Waters. He's out there in a potato field waving at you. Tim is Washington State University Extension Educator. Now, we're just going to have a roundtable discussion, and we have a lot of questions that we've developed, and we have heard from other people ask. And basically, what we're going to do is start off discussing employee screening. So, what do you do to make sure your employees coming on site are not carrying COVID with them?
So I can start on this because obviously we have a screening. So first of all, I have a packing shed farms and I also have an orchard. So we put together I don't want to call it, but that's what I call it, COVID-19, kids. So you have a face mask, you have gloves, you have the thermometer, infrared thermometers, you have the alcohol spray, and a list and a clipboard with a list of employees. So when this is all started, we were basically having a log. We're logging the names, asking them questions, logging the answers, and kind of recording what we get on the thermometers. We kind of went away from a logging staff, and now we're just doing the checks. So bottom line is the employees will show up on site, one place, they will line up. We always tell them to be on time, and they will go through the process. And in our farm shop, when there's 20 guys, it takes less than probably 5-7 minutes altogether if it's smooth. In the packing sheds, when we have 50 to 60 people, we kind of did the drill right before we implemented. We did the drill, and we have 2 thermometers. We can basically finish this in a matter of less than I'll say maximum 15 minutes. So in the packing shed, you have 2 people doing checks. In the farm shop, you have 1 person. And then, of course, every supervisor in the orchards that we also use have their own little kit that they'll check. So
with regard to screening, what kind of records are kept?
At this point, we only mark a name of a person. Person that was present, and we screen them. We don't check if they say, yeah, I have headaches or anything like that. We do not write the temperatures. We do not keep the temperature records of any kind.
So I assume if they have a fever, they are required to go home.
Yes, and we have a procedure. That was another part of steps that we did. So when we put the kids together, we went into each location and it says, okay, who's in charge of doing temperature? Person says, I am. Okay, that person is sick. Who is the next one in the line that will take over when that person is not in? So we had at least 2 people, and in a packing shed, 4 people team that's responsible for taking temperatures. So they need to come in, 15 minutes earlier so they can grab their staff, so they can grab the face shield, so they can get ready for it. So when the employees roll in, they're ready to go. And then, yes, we design a procedure of what exactly means to have a fever. And, like you heard from probably a lot of different sources, 100.4 degrees, it's our line. So if you come in, and our thermometers, most of the thermometers we bought it changed the color with a temperature. So, the little fancy ones, either they show green, either they show orange, or they show red. Obviously, so far, and we're doing this for now several weeks, we haven't had anybody that came with a fever. We had a couple employees that came in with what I would call elevated temperature, and we basically says, okay, well, by our procedure they don't have a fever, so okay, we'll check on them again in the afternoon, kind of a thing.
I see.
So it's not just one-time deal. And then of course, there's also, we thought that because people driving in the cars with air conditioning on, or they're drinking something hot before they come to work, that these thermometers are not exactly accurate. Every single one we bought it's plus minus half of a degree kind of a thing. So you are just wondering. So we said if we get some kind of elevated temperature, we will let the employees sit in their car for 15 minutes, and we'll check them again and see if it was just something because of the way they travel, or because they were standing in the sun, or things like that. So we have some kind of corrective action. But then yes, if we would get the 100.4 once, and then second time the employee would go home, and they will be advised to go and see a medical professional.
So obviously they would have to go through the same check again once they came back to work.
Well, that's a little bit different conversation. If the employee is sent to a doctor, and the doctor says, no, I'm not going to test you for COVID. No, I don't think so. You have a COVID. I would not let the employee come back until they'll call in and says, okay, yeah, I don't have any symptoms. I think the fever was just something different. I'll let them come back and we'll test them, let's say the next day or 2 days later, kind of the thing. But if the employee goes to a medical professional, get tested for a COVID, they will not return until I get something that says COVID negative. So, there's a little bit 2 different steps, 2 different situations we're talking about. Because, person can be, I don't know, had a cold or something else is going on. So that's kind of a 2 different situations we're talking.
Okay. Well, Marcin, have you had an employee call in sick and think that they might have COVID?
Yes. So since we started this entire experience, we had employees that got tested. We had employees that got tested and reported they're positive. We had employees that says, well, I'm not coming to work because, and they listed, I think right now we're up to 10 different symptoms. If you go look on the list, yeah. And they said, I have X, Y, and Z, automatically we'll say, you know what? I'm not a doctor. I'll recommend stay home. We'll consider you as a person that possibly has some issue. Go to a doctor, ask a doctor if you should be tested. If a doctor said no, that's fine, call us back. But we'll still probably say, hey, can you stay home until the symptoms go away, or till you really feel like you can work? So, I don't want to be a doctor. I don't want to be an epidemiologist, but in certain way, we all become a little bit of both because of, pressure on our medical staff.
I see. Well, Dave, if you could field this question, are there any requirements from the state, any mandates from the state regarding when an employee can come back, or any kind of testing that is required? Anything like that?
Yeah, so basically what you're going to hear from an L&I standpoint, and again, kind of one of the things we explained in a few of the previous webinars that we did is we're kind of in an unusual situation because normally when there are rules that employers have to follow, L&I is really involved in developing those. But really everything that we're getting now, especially as it relates to COVID, is coming from the governor's office. So we're kind of being told what it is to do. So really any direction regarding what you would have to do to test an employee is either going to come from the governor's office, and again, really 10 out of 10 government agencies is falling back to follow the CDC guidelines. So I'm kind of looking at it right now on the CDC website. They have a whole section on how do I screen employees? What do I need to do to screen employees? When can they come back to work? How long do they need to stay away from work? All those questions are answered. So, the governor's office, L&I, we're all looking back to CDC guidelines for that information to tell us what and when to do things. So you won't have any special requirements from L&I. Marcin captured it perfectly. We don't, from an L&I perspective, especially, and really any state agency's perspective, we don't expect you to create records and document all of these things because you're getting into kind of HIPAA concerns and that type of thing. All we're asking that you do is screen your employees, and you kind of do that, again, following CDC guidelines in the way that you see fit. And as long as you're doing some type of screening, taking a temperature check, asking them the questions, or having them self-report, you're meeting the requirement. We're not going to come and ask to see logs or paperwork or anything like that. We're just going to simply ask you if you are doing the procedure and following the procedure and going on from there. One of the biggest things that we hear from employers is, I can control what my employees do at work, but I can't control what they do when they're on their own time. And that's where we would say, the screening is just critical to making sure that you're not allowing people that are sick into your facility and spreading it around. So that screening can be critically important. So I hope that kind of answers the question, but I'm happy to answer any follow-ups to that as well.
Thank you. Faith, if I recall, you had some really good links and some that were in Spanish.
Yeah, so I'll go ahead and put in the Q&A or the chat function, a link to our Q&A for the industry where from past commodity-based sessions, we've captured some of these answers. So others can go to that and look for when, or if you need something in Spanish to distribute.
Do you have that available right now? I think you can share your screen.
Oh, sure. I
just hover down at the bottom of your Zoom window. There's a share screen.
I'm actually navigating to the page right there. So.
Okay. When you get a chance, put that up. I maybe something that easy for people to.
Yeah, we've kind of broken it up. I'm a microbiologist, so I'll put the sanitizing and disinfecting stuff was some of the first questions I got, but we have some kind of basic, the translations on the other side, but some grouping. So crew management, testing, worker hygiene, training, COVID response plans, worker safety, mask and other barriers. To look through, because you'll remember today and you may go back and listen to this webinar, but it also kind of helps to be able to reference something long-term.
But just for the group, how could somebody access this webpage? Just type in COVID-19 and Washington.
Yeah, so it's actually from our food safety webpage, and I put that link in the chat function, at least I thought I did. Where they can go through, and just go to that link, and then they can, and if you have questions that aren't addressed on here, please feel free to submit them right here. It'll just take you to a little survey link. But does everybody see the?
Yeah, the link works.
Yep. So you can access that there, and otherwise it's foodsafety.wsu.edu, and it's one of the menus up at the top.
Fantastic. Well, let's switch gears just a little bit and talk about distancing and personal protective equipment. David, do you have some perspective that you can share with us about distancing and PPE?
Well, so we really have the two requirements that we are asking employers to do, and that is social distance wherever possible, so at least the 6 feet. And then employees you need to wear a cloth face covering unless you meet that definition of working alone. And rather than me trying to explain that, we'll probably just send that out in a link. We have what the definition of working alone is so that you kind of know what that is. And it's generally that you're not really there's no chance of you having contact with another person. So it's pretty, there's more to it than that, but that's just the basics of it. So really that cloth face covering and the social distancing of 6 feet is all we're kind of asking at this point. And, in addition to screening, but, from a PPE standpoint, really, when we're talking about agriculture or when we're talking about construction, all of the regular PPE requirements apply. The only thing that we're doing different is the cloth face covering. Now, you've probably seen some things that have come out recently about the effectiveness of different types of cloth face covering. And while that is all well and good, at least at this point, we aren't being told, like what we are hearing is bandanas are less effective. Well, but we know that bandanas are one thing that a lot of people in agriculture will actually wear. So, we don't want them to take away an option that they would actually use. So, yeah, for right now, neck gaiters, cloth face mask, a bandana, anything still meets that cloth face requirement. Probably one of the biggest questions we're getting is, can I wear a face shield instead of a mask? And the general answer to that is no, because a face shield by itself doesn't stop the droplet spread. They are coming out with a new shield that has a skirt that it actually encloses it to the neck and is sealed at the top at the head. Those will possibly be allowed as an alternative. You might see some of those. They're not exactly the most comfortable thing to wear. So in general, a face shield can supplement a mask, but that cloth face covering is still pretty much going to be required unless you're working alone. And I'm trying to think, there was the kind of the secondary question to this, and we had this discussion with the grape growers, because this time of year we're also dealing with heat stress, and people are worried about the mask contributing to heat stress. And I would say that's what it really is. What they've found in the studies that they've done is it really doesn't add a lot. Now, yes, it's a factor because you're wearing something on your face, but it's not enough to put you into heat stroke or heat stress by itself. So really the concern about wearing a mask is not adding to that. So you just, again, need to take into consideration your regular heat stress protocols, taking breaks, drinking lots of water, that type of thing. But it hasn't been shown to really have, again, it has to have some effect because it's a piece of cloth on your face, but not enough to really tip the scales to say that you don't have to follow the heat stress rules. So that's kind of in a nutshell where we're kind of coming from a regulatory agency.
Well, David, if people can maintain more than 6 feet of separation, do they need to wear masks?
Yeah, so that's where that definition of working alone comes in. And maybe if while we're on the call, I can find the exact definition. Maybe I can just post it in the chat function. The only time you wouldn't have to wear a mask is if you can meet that requirement of working alone. Any other time where you may have contact with somebody, you need to wear a mask or at least have a cloth face covering available to you so that you can put it on. We're kind of seeing, you'll drive by a construction site and this is what you'll see. You'll see workers out there, far enough apart that their mask is down around their neck. And then when they're coming within 6 feet, they pull it up and then they walk over. And then when they walk away, they kind of pull it down. So, that while that might not technically meet the requirement, are we going to stop and say, you're violating the mask rule? No. I mean, there's got to be some common sense involved as well. So I'll see if I can pull up that definition just so everybody's kind of working from the same definition, essentially.
Well, let's switch gears a little bit. We can come back if we need to. We can come back around to PPE and distancing. But I'd like to talk about places and activities in potato operations that are of most concern? And the first thing that comes to mind for me is any activity at a sorting table where you have people in close proximity. Marcin, do you have some perspectives on that to share, especially in the packing house?
So one of the exercises we did, or a process we did, was, as soon as we start hearing more information and we learn more about this problems, we went kind of around, or I did, and some of the people I work with, because, again, in our operation, I cannot take a full credit. It was a team effort from the beginning. But we went around and says, okay, here's the piece of equipment. This is what happens. This is what we remember from last year. Or we went to a packing shed. We look on every single place and we says, okay, what can we do? Our choice was, can we change how people stand around inspection table, or where they stand around inspection table, or what kind of jobs they're doing? Can we move them 6 feet apart? And there are some places when you are able to do that. For example, you can move 2 ladies to opposite corners of an inspection table and you have a 6 feet. As long as you monitor them and they do not come, face to face and start talking about their, family vacations or weekends. Going into storage inspection table, usually there are at least 4 people. So now do you have to have 4 people? Can you have less people? We'll kind of attested this when we start going to the storage. And then we'll have to decide it, okay, just so you know, from a day one, our company has mandatory masks. So as a, basically in Basin Gold, or in our Conley operation in Warden, company decided that as a company we'll be issuing single-use masks. So we have blue ones. We had opportunity to get some material mask, but we decided that there's some questions related to cleanness of this mask. So as a company, we issue our employees single-use masks. We have plenty of it. One of this year Christmases was when my first order of masks show up. I thought Christmas came early to me. But the bottom line, people can get the mask, they get dirty, they can get another mask. We require them to wear a mask. If they cannot maintain 6 feet, then they have to wear a mask. If they can stand 6 feet apart and do the work and be not closer, then we allow them to pull the mask off. But generally speaking, like David was explaining, is there are some moments where, you walk by, they pull a mask, they put the mask up. We also made some decisions right away about, for example, we do not let anybody that it's not company employee or a staff to enter our packing facilities. So the truck drivers come and pick up a load. He sits in his cabin outside waiting for a phone call, and the lady that brings him a paperwork wears a mask, and they sign. We give them a paper, and we do not let them get on the loading dock. We basically stop selling potatoes to the customers, basically shut down the door and says only employees. We also shut down the lunchrooms because our lunchrooms are so small that there was no way that people could maintain 6 feet. So we says, okay, we understand, but no more lunches inside the lunchroom. Please do it in your car or go somewhere else, or pitch a chair and sit. And by the way, be sure it's 6 feet apart. Same on the farm shop, lunchroom was too small, so the guys it's warming up, they'll make a big circle outside in front of the farm shop, and they pretty much stay apart. One of the things that you have to give your employees a lot of credit, because they have families and they understand, and they come in and they'll monitor themselves. So that's a little bit of a help. But again, it goes about going, looking at every single position, every single piece of equipment, every employee, trying to figure out what they do, how they do it, what do you have to do to keep them safe. There are some positions that we cannot change. When you bag a bale, you have 2 guys standing, one holds the bag, the other throws the bags, plastic bags inside. I cannot re-engineer that kind of work. So they better be wearing masks. They better be washing hands. They better be sanitizing hands. We we got a new hand washing station. We added, hand sanitizer stations. We have a plenty of soap. I have to admit that, on the beginning, we were going to liquor stores. We were counting every drop of a sanitizer. We're filling the bottles only 1/4. Right now, I can fill every single hand sanitizer station up to the rim because I have a plenty of hand sanitizer. But, 3 months ago, we went all the way down to probably 3 gallons worth of a sanitizer for, close to 150, 200 employees. So, we already worked through the supply issue. Right now, I think we're pretty good because we can buy stuff. It's not the problem. Maybe the problem is it still costs money. So, I don't want to share exact amounts, but you can imagine, extra hand sanitizer, mask. This is all extra dollars that we're basically spending, and we're fine with spending it because keeping our employees safe for the next 2 months, it's just, we wouldn't make it. I always bring this example of you can lose one apple packer in the orchard on the COVID, but think about if you lose your best, digger operator. You wanted to put me behind the wheel to dig your spuds, I can promise you the bruise-free claws ain't going to be looking pretty. So, so we will keep watching. Right now, we have everything in place. Right now, what we're going to do is when we start harvesting, when it gets busy again, we'll have to spend extra time being sure that we walk around and keep people separated, that we say, no, guys, you need to, take extra step. The way I measure 6 feet, I told my folks, if you stretch your arms in the front of you and the other person there stretch their arms and you guys are not touching or holding hands, that's probably about 6 feet. So, that's kind of a quick for them to understand what the 6 feet is. I said, do not carry, your measuring tape and trying to measure, your 6 feet on the ground and says, this is the line kind of a thing. So again, as we learn more, as we work through all the processes, I think we have a pretty good system in place. That doesn't mean that it doesn't have to be changed or modify or improve. So, any ideas are good. One of the things I already spoke a couple times about putting the shields up, but the problem with the shields is, well, first of all, I don't know if any of you check the price of plexiglass or any kind of a clear material. So, again, it goes into a cost of, I think with washing hands, wearing masks, staying 6 feet apart, that's pretty good plan. And if everybody's doing this, then we are probably on the right directions.
So I have a comment about the 6 foot distancing. I have a lot of young employees that work for me, and I find myself constantly telling them to separate and put masks on. I was talking to my nephew the other day, and he works at Boeing, and he said you get 1 warning. On the second warning, you go home. And then you don't come back to work for so many days. So I don't know if other people are having issues with that. And I think Marcin said that, most people are relatively responsible with the social distancing and understanding the implications, but there's certainly some people that aren't taking it seriously and are probably more difficult to keep up with that. So does anybody have any strategies for those more difficult folks with the social distancing?
I'll speak up for a couple that I've heard, Tim. The primary one is sending people home. So, and they stay out at least 1 day. So they remember from then on. It's funny that you don't have to, but that is, you have to think about, do you give them 1 grace and then, on the second time they're going home? Because it seems to be the more swift that is, then the better it'll be. The other strategy I've heard is actually enlisting couple of other of your employees that are going to help you keep an eye out basically and help, and everybody knows that they're coming around and they're also watching for stuff like that because the COVID police are coming out to make sure you're social distancing. But I think it takes a bit of policing for that 2% that is just kind of either doesn't perceive it as something that's important or whatever.
Well, the comment I wanted to make is the people that we have on the farm, they work in the teams, and the teams usually don't change. So they already treat themselves as a family. So, you know, like I said, yes, there are some people that you probably will find yourself constantly talking about masks or putting a mask or staying 6 feet apart. But the other issue we have is, you know, yeah, if I really come across a really bad apple, I will be probably the one that says, yes, I think maybe it's time that, you know, it's not worth it having that person around if they cannot understand. But Tammy is right. It's easier with older employees, and it's a little bit different with the younger employees, you know, and that's where it's, you know, the supervisors, managers, and people that are, you know, kind of working this COVID-19 process from the beginning. You know, that's where it's important that people need to stop in, because I can walk in and I can warn somebody, and then, you know, I turn my back and walk away and they'll go back. So it's somebody needs to take a charge with each team. And if there's an issue, maybe you need to mix it up, you know, kind of separate them, says, no, you go, okay, you guys don't understand. So one of you go to one end of the facility and do something else, and second person stays here. Well, I don't like doing this. Well, tough luck. If you cannot stand 6 feet apart, you get the really bad job to do. So, you know, again, any ideas, anything that you can do to keep the employees 6 feet apart, I think it's a fair game.
David, can you speak to any like inventive barriers that you've seen, or barrier material maybe that you've seen utilize?
No, but I want to buy stock in plexiglass now. That's definitely, it's interesting. I have a nephew that lives down in Shelton that they actually have a photography studio, and he's pretty handy, and he made some plexiglass for their local hospital. So they're actually manufacturing some of those things. I think in the grape growers, we saw a really good, I can't remember which company it was, but they had some picnic tables, and they had put these dividers up, these plexiglass dividers, so that their people could sit at picnic tables, which was interesting. But we have seen in the berry growers, so they had done some plexiglass in some of the packing houses. They actually, because they did a couple of mitigation things, they were actually able to drop some of the distance down to 3 feet instead of 6 feet, because they had some barriers in place. So there are some creative things out there. What I will add to kind of what you guys were just talking about, you know, the requirements that you're going to have from either the governor or, you know, L&I or the CDC are really just the minimums. And so the point that we usually make, because we get that from employers all the time, you know, what do I do if my employee violates the policy, or they don't want to wear a mask, or they won't wear a mask? And our answer to that is, you know, this policy related to COVID-19 is just like any other employee policy you have. So hopefully what you have is you already have a good disciplinary program in place, like you in your employee handbook, whether it's a 3 strikes policy or whatever it is. And again, you get to decide as an employer what that looks like and what it is. A lot of times it's, okay, first time it happens, you get a verbal warning. Second time, you get a written warning. Third time, you get sent home for the day, or in some cases, you know, I've seen companies that'll have fireable offenses. Like if you are not wearing your fall protection, we can essentially fire you on the spot. So again, those policies are up to you as an employer to develop, and then just make sure you're being consistent and follow the procedure and the policy. That way, if you do have an employee that you're having to discipline because of they won't wear a mask or something to that effect, or they're not social distancing, you've got something to follow, and you're being consistent with your existing policies.
I want to point out that David put on a definition on the right side of your Zoom screen, a definition of working alone. And this brings something to mind, David, and Faith, maybe you can chime in also. If you're in a tractor all by yourself, I can imagine that would be considered working alone.
Yeah, absolutely. Yeah.
What about the next guy that gets in the tractor right after you?
Yeah, so the way we handle that, and then Faith can talk about this too, is the CDC has guidelines for disinfecting, and that's all we would say is, sure, the operator in an enclosed cab or on a piece of equipment by themselves doesn't need to wear a mask, and if they don't have contact with people, you're fine. But when you switch operators, you do need to disinfect so that they get a fresh piece of equipment, essentially. So I don't know, Faith, if you can you add to that a little bit?
Yeah, I'm going to share in the screen in the chat feature right now the EPA list which is the list of disinfectants that the EPA has cleared for activity against the virus that causes COVID. It's a family of viruses that cause COVID. So you can go to that link and essentially many of you already have a sanitizer on hand. I would start by checking if that sanitizer is on this list. If not, it doesn't mean that you're completely out of luck. Although most of the sanitizer companies have gotten added to this list over time. I'm there now, and it looks like trying to see how many. There's 478 different products listed there right now. So look for the one that you have in stock and on hand or can get readily available. If yours isn't on there, then I made a YouTube video just walking through actually how you use this product kind of list in, and then how you can look at those product labels and compare if they're not on list in. If they are, then the things you have to pay attention to are, okay, what's the concentration of that disinfectant that I need? Is it ready to use straight out of the bottle? Do I have to dilute? And then what's the contact time? Most of them are around 10 minutes. And if it's something like a alcohol-based disinfectant, then you just need to make sure to get it wet enough that it doesn't totally evaporate before that time. Otherwise, that's the primary thing that we're thinking about. And I think a lot of places where people have saved themselves time and trouble is really trying to think through, okay, this surface used to be what we consider high touch. There were a lot of people touching it, but can you change the way people are interacting with that so that it is not quite as frequently changing hands? Because essentially that cuts down every time when it goes from me to you, it needs to be disinfected. And that is really, if you can try and protect that, you have fewer people going around just disinfecting things. Because even with that being said, where you minimize that, you still will have a lot of people going around and doing like handrails and knobs and a lot of things that you just can't phase out of your operation, right? While we're on talking about disinfecting, per the governor's guidance document, I'll put up the frequency, but essentially with disinfection of those high touch surfaces, it's either when it goes from one employee to another, if it's something it's like a hand tool or something along those lines, or the truck cab when you're moving from one employee to the other. The other thing is like for those more just kind of general area like handrails and things along those lines, you're disinfecting those at startup, after your first break, at lunchtime, at your second break. And then if you have changing over multiple shifts, you're going to have another series before those two crews kind of intermingle. So it's basically like trying to put in breaks and where we could see potential transmission if somebody is sick in your operation. So clearly pack houses have a lot more of that going on than, maybe you would have with field activities. But I think a lot of people, like I said, have saved themselves time in trying to figure out, okay, am I better off just assigning this to one person and they do that so I don't have to disinfect as frequently?
A couple of questions from people. First was, are there areas that we should be concerned about in warehouses and the field that are in addition to what the CDC and Washington Department of Health suggests? What about things like bathrooms, restrooms, washrooms?
Sure, all of those are going to be getting a lot of use, right, throughout the day. So you would want to be disinfecting those kind of common use areas. If you didn't shut down your break room, or you just had the break room open for employees to warm up their food and basically get out, you would need to come through and disinfect those areas as at least prescribed in the governor's orders. I would say don't forget about anything that people's hands touch, right? So a lot of times it's going to be like the faucet knobs, right? On disinfecting those, because people are touching them. And if they are washing their hands, they can still act as a good transfer point. Yeah, and just some people have begun to keep doors open more and prop them open so that people aren't having to touch them quite as much. But otherwise, yes, it's everything. It's not just the production area.
Do we have to be concerned about product? So for example, we have our folks on a sorting table touching potatoes.
Nope. COVID has not been linked to food transmission. So the FDA came out with that statement very early on, kind of like way back first part of April, that, an ill worker and you having an illness, even if that worker was on the sorting packing line, that did not necessitate a recall or anything along those lines. Now, if you're exporting, other countries are always good with throwing up barriers, but that is the line that the FDA is towing. There's no evidence of transmission through food.
And with regard to surfaces, what length of time do we have to be concerned with? Will that virus be viable there after an hour, 2 hours, 3 hours? We have any guidelines?
Yeah, so generally speaking, it's 2 days is the longest roundabout. It will hang around an area, yeah. And it depends if it's exposed to UV light from the sun, say, versus totally enclosed inside. UV light does help break it down. Drying out helps break things down. So all of that's highly variable, but tends to be like your more porous surfaces, like a cardboard. It survives on longer than, say, like a stainless steel and things along those lines. But that's why disinfecting is important, right? Because you're going to be using that surface again. You're not going to have the 2-day window. I would also tell people it's not a good idea to say, okay, I have the weekend, or I have a couple of days off and I can get those couple of days in. Just go ahead and disinfect the way that it mandates, so you're not relying upon something that may not be 100% effective.
Well, I think we covered most what I want to cover. But what about outside? Is transmission not as likely from people working close together outside as inside? So if we're on a sorting table during transloading operations, do we need to be as concerned there? Does anybody have any perspective of that?
Well, I'll make a comment, okay, going back a little bit. So for example, the surfaces that people touch a lot. So we had some plastic curtains in our packing facility, and they were in place because of food safety requirements, everything else. Well, guess what? They're all gone because, we were looking at this and people are going through the curtain. Obviously, everybody's trying to push the curtains apart so they can go through it. Well, no more curtains. On the working outside and being less exposed, I have to say that obviously we're, 5 months into this. On the beginning, we walk into this without very much knowledge. Right now, I have spent so many times on the webinars and reading and getting educated by it that, I do feel a little bit better having employees working outside when there's fresh air and the circulation. Everything I heard is the worst you can have, it's a small scale office where 3 people are, one is scaling, the other is doing paperwork, everything else. That's biggest concern to me, say in a potato operation than for example 4 or 5 guys in the field working, because there's always social distancing, even if it's not always exactly 6 feet, but more air, being outside, I think it's safer environment than closed door or closed offices.
Yeah, and we have seen that ventilation has been cited frequently or lack, I won't say it's lack, right? Like we don't design packing sheds like hospitals for air turnover, right? So it's not that it's a lack of ventilation, but they're not designed to turn over air at the frequency you would need to really try and mitigate the risk of person-to-person spread if you had somebody who was infected. And outdoors, that factor's kind of taken away, right? But again, everything's kind of in this gray zone of, nothing's 100%, and it's best to lean on, it doesn't mean that if they're outside, social distancing is important, right? Everything kind of adds up together to make your operation the safest you can for your employees.
That makes sense. Marcin, David, maybe you can comment on this. We talked about, to some degree, modifying procedures to reduce spread. What about driving? What about, can we actually two employees in a vehicle together?
Yeah, I can kind of address that. So one of the things that we've actually seen, and there's been a lot of research on, is it does spread when people are carpooling. So for instance, right now with the state, where we were normally encouraged to carpool, it's been pretty much banned. You're not allowed to carpool. And so what we were seeing with agriculture workers is a lot of times they were using vans to transport people or mass transport people. And what you have to do is you have to be able to have that 6-foot separation. So you could have two employees in a vehicle, and usually it's kind of like one in the front seat, one diagonally in the back seat, but then they need to be wearing masks. So it's kind of a yes and no answer. If you can get away from it, keeping people not in the same vehicle is your best bet, because they are seeing the transmission rate go up in carpools and when people are sharing vehicles. We're getting a lot of that from counties and utility districts. Normally we would send 2-3 people in a truck. Now they're sending them all out in single vehicles. And then we also get that question about, well, what if I have employees who carpool together? Well, when they're on their own time, again, you can't tell them what they can do on their own time, but you can highly discourage against it, or at least, again, that's where your screening really becomes critical. So
I wanted to add something. So first of all, one of the things that we did on the farm was that as a company, we have employees assign pickups and vehicles that they're driving, and basically told them if there's a need for 2 of you go to the fields, 2 pickups go, and obviously we said if it's possible, don't ride together. But if they get together into a pickup, I don't care that you are working on the same team and you are in a potato operation or you're onion operation, you guys will be wearing masks and you guys will take, and the sanitizer and everything else. But we really discourage people from driving together on the job. The carpooling after work, well, that's kind of, there's 2 things. Yes, we talk people, we mentioned them during the training in the packing sheds. But the problem is, some folks pull together because they belong to the same family. There's a risk. That's probably a smaller risk than two guys from 2 different households, carpooling to work. So again, part of the thing is we can control when our employees, or most of the times we can control what our employees are doing on the job for the 10-12 hours that they are under our supervision. But after they leave, after they clocked out, that's really truly honestly what scares me the most right now. I'm not scared about employees getting sick on the job because there's infection and spreading. I'm really, most of the situation where we have, it's coming from outside, from a community coming to our workplaces, and then we have to deal with it. And it's not surprising the way this COVID-19 is spreading, that, they go on the weekends and they decide to go to a party or do something else. I cannot tell them not to go to the parties. I cannot tell them you are not allowed, because that's their private lives. But that's where it's difficult. One of the things that we did too is, you're talking about carpooling or transportation. One of the things we did on the farm, for example, idea came up that, we have a lot of truck drivers, the 10-wheelers, the semis that will be hauling potatoes for us from the fields to the storage. We used to have we used to have this process when, you know, they get the handwritten tickets. Well, idea came out, how about we just issue tickets for an entire day to each truck driver? They'll only see our folks at the main scale. The tickets will be, you know, given to them through kind of a little hole in the window. And when they get to the field, whatever they have to fill out, they fill out themselves, and they are not talking to our operators at all. You know, our operators sitting in a cabin, locked, safe. They are digging potatoes, and the truck driver comes in, they have a tickets, they just write the time, and they confirm that that's what it is, and come into the scale with a ticket already pre-printed. So again, that was a good example of a really team effort. The idea came from a farm, between us put together, you know, and now obviously people, our scale ladies that are handling the operation management of this new process. So again, you know, we are trying to eliminate as much contact between outside folks that we have to hire, like contracted truck drivers, with our employees that, you know, because like I said, we still have 2.5 months to go with this until the harvest is over. And obviously, I personally believe that this year, this crop year, and we'll still be talking about this next year, and we'll still be doing COVID-19 in summer of 2021.
Marcin, thank you. That's a great example of modifying procedures to reduce spread. David, I have a question for you. Do we have a perspective of how long a person who had COVID can transmit the virus after symptoms expression is over?
Well, let's see. I'm not a medical expert. I'm kind of going off of really what I've heard from CDC guidelines and what's come out of the governor's office. And what's coming to mind is, you know, when you have somebody that has tested positive or is feeling sick or is showing symptoms, there's that whole self-quarantine for 14 days, essentially. And then a lot of employers are requiring, you know, if an employee does get a test, that they get basically a note or certification from the doctor that they're clear to go back to work. And you can certainly ask that of your employees as well. You know, again, it kind of depends on the situation that you're looking at. I was just looking at the CDC website, and again, that is really your best source of information, because they have this frequently asked questions thing. And I mean, just about every question you can come up with as far as what do I do, how long do I have to wait, what should I do in this instance, they've answered pretty well. So I would definitely use that as a resource. That's going to be a really good source of information.
Hey, David. Oh, sorry, Matthew. I had a question kind of related to that. And what is an employer's responsibility when it comes to contact tracing for people? And say one of your employees has contracted it. Is it your responsibility or the county health department's responsibility? Whose responsibility is it to trace the people who have come in contact?
Yeah, well, so tracing, kind of like where did they get it, where did it come from, that's more going to be a Department of Health thing. The guidelines that I'm seeing, and again, I'm going to sound like a broken record because it comes from the CDC, but is that, so you as an employer, when you have an employee that maybe say tests positive for COVID-19, then your obligation is to notify the other employees that employee had close contact, and that means was within 6 feet. Again, I love this because, you know, they're giving us all these definitions, but they're not defining them. So for a significant amount of time, which has no definition, you know, we've heard 10 minutes, you know, it's kind of all over the board. But so your obligation as an employer to notify those employees that other employee might have had close contact with, that you had an employee test positive for COVID-19. The key there, again, too, is you're not allowed to share who the employee was, because you have to be mindful of HIPAA violations. So you can't use names. All you can do is simply just say, we believe you may have had come in contact with somebody who tested positive for COVID-19. And then beyond that, the procedure is, you know, whether or not you want them to say, self-quarantine for 14 days, where the example that I'll use is like we have had L&I employees in various regional offices, and then we've had a positive test. So what L&I has done is notified all of the employees that potentially came into close contact, told them to, essentially either self-quarantine or watch their symptoms, and then thoroughly disinfect the office if that was where the person was, so that again, according to CDC guidelines, that the office has been disinfected. So Carrie, does that answer your question?
Yeah, I think so. Is there, as an employer who, I had one employee that was sick for a while. She didn't end up having COVID, but she did get tested. And she just had something else. But, it brought to how am I isolating this person until we get a result? And, I just wonder what employers can do to protect everybody else that's on the crew. Because one of the questions that came up in our previous submissions of questions is, how do I make sure that one person on my crew getting sick doesn't bring the entire operation down?
Yeah.
And the Chateau Saint Michel people actually during the wine grape meeting, because I listened to that, talk about shifting their employees in pods and really assigning them to very isolated groups and responsibilities. And there wasn't a lot of mixing among some of those categories. There were a lot of clever things they were doing there. But in isolating so that it didn't, one employee being sick and maybe having contact with everybody doesn't put everybody at risk, but it puts a smaller group at risk. But all those questions come up.
Mm-hmm.
So, what I wanted to mention on this subject is this. First of all, we had some experiences. So we had a person tested for COVID, came up positive. It took a health department 5 days to call in and inform us. So by day number 5, I think this is basically not information useful to me anymore. But because most of our employees, either we know that they didn't come to work, we kind of call and check on them, and if they say, yeah, I got tested, okay, well then we go into this, okay, but you don't have a results yet. No, you stay home till you get the results. But in the meantime, as an employer, we go in and says, okay, this is the employee, this is the job they were doing, this is the team they were working around, and we start collecting names or saying, okay, how long did they work here, here, here? And we have, by the time they get the test positive or negative, we says, okay, there's this group of people that possible we need to do something, either inform them. But generally speaking, one of the things that we're lucky enough is we have a friendly doctor. And when we had the situation when we had to send additional employees for testing, it was done very quickly. But right now, what we're struggling like anybody in this situation is, we have a test that some people get the results in 3 days, and we had an employee that was sitting basically entire week waiting for it. So, there's no guarantee that you're not going to shut down your operation, but there are some steps as an employer that you can move forward. You can, for example, do that traceability, tracing who was where working with who, so you're ready to go. Right at the moment when somebody calls, it's positive. I know now, generally what we recommend folks is, oh, by the way, David, I understand, I don't mention name, but even in our larger operation, by the time everybody knows everybody, and as soon as you mention something like we wanted to let you know that possibly you got exposed, guess what? They already know the name. So, but we usually recommend employees that we think spend long period of time with a person that came positive to seek medical advice, go, and if they need to get tested, they get tested. And then, obviously they may have to wait and they stay home. But again, there are some federal programs that allowed us to pay them and help them financially. So really, truly, honestly, the situation we had before was employees kind of understood, they followed the rules. They got their test, they got negative, they came back to work, and it wasn't a problem.
I think what I'm going to do is open it up to questions from the group. Instead of writing your questions and sending them to us, why don't you unmute yourself if you have a question to ask? So we've got a good panel here with a lot of good ideas. Does anybody have any questions that you want to bring up?
I'll ask one if nobody else wants to right now.
You're bold, Carrie.
Yeah. So I'm curious about hand washing. What are an employer's responsibilities when it comes to hand washing stations in the field, outside? Do you have to provide, is it based on sizes of operations? Do you have to provide some kind of hand washing facility? Is it a good idea? And does that need to consist of things like hand gels or water, soap? I don't know.
Yeah, I can answer that, and there's a document that we can provide that was right out of, I kind of lose it, but it came out of there's part of it in the agriculture standard, and then it was part of it was clarified by the governor's office. But the short answer is yes, you have to provide hand washing facilities in the field, and the hand washing has to consist of some type of water and soap. So you can't just use hand sanitizer out in the field. You have to provide some type of a hand washing station, and then kind of based on the operation, it has to be, there are distances. They have to be a certain distance from one another, and we can provide that information to you. But the bottom line there is absolutely. The biggest thing that we have seen for prevention and the best sanitation is hand washing. So that's why we're saying, the standard says running water. Well, sometimes that's impossible. And so where you can't do that, it's just a water supply of some kind. Sometimes it's you've seen them next to Santa cans that are a foot pump that has a water tank, and it gives you water, and you've got soap right there. But really the key to that is soap and water. It's actually soap, water, and towels. And then a place to dispose of the towels essentially is the minimum requirement for everybody, pretty much regardless of where you're at.
And David, do you want to elaborate on the mechanical harvesting versus any like the requirements for having hand washing stations in the field versus more like, I don't know, if you're doing hand sorting or something like that?
Yeah, so that's what I was trying to come up with it on the fly, but I don't have it sitting right in front of me. But it's the hand picking operations where the stations have to be, is it 150 feet?
It's 110 yards.
110 yards.
Mm-hmm.
Yeah. So that only relates to hand picking. For machine harvesting, it's just you just refer back to the agriculture standard, which again I don't have it sitting right in front of me.
I believe
Yeah, I think
a quarter of a mile, within a quarter of a mile of operation, and plus then you refer back to the food safety requirements. So yeah, and on the note of hand washing is yeah, we usually give a soap towels and running potable water in our wash station. But the other thing that we have done to all our operators, all our farm workers, company issue them a hand sanitizer. So they have their own personal hand sanitizer bottles. If they lose them, they'll get another one. If they empty, they come back to the office, get refills. So yes, we are not telling them hand sanitizer only. We constantly reminding everybody hand washing as many times. And obviously, it's our job to be sure the water and soap is there. The problem for us was right away that, we rented extra hand washing stations, and quick enough, 3-4 months ago, we found out nobody wants to give us a soap to it. And now if a supply is being back in stock, we have a lot of extra hand washing. So, but anything you can do, like I said, we give the folks surface sanitizers. Each person on the farm got the bottle of sanitizing, disinfecting type of a item, and then a hand sanitizer. Like I said, as soon as they are empty, they can come in and we are refilling it. No question asked. So again, anything we can do to help the employees on the farm.
I have a question for you guys. What can we do if, like, when carpooling's not, like, we have to take our crew back and forth to the site and that. So, and then a lot of them have driver's licenses, so we have to take them in van. So what's the recommendation there?
I was afraid of that. Nobody else is going to speak up, so I have to speak up. So again, I realize this is maybe not necessarily the easiest thing to do, but what we're saying is not that you can't carpool, because we realize that there are sometimes, but you have to maintain. You have to try and maintain 6 feet of difference in between people, and then ensure that they're wearing a mask while they're in that. And then what we would say, and again, this is going to be dependent on time of year, is, you know, roll down the windows, try and keep it as ventilated as possible, but really it's wear a mask and try and keep 6 feet of separation in between people in the vehicle. No, that's not super helpful, but that's the best I've got.
Yeah, David, I would say I've seen a lot of carpooling still occurring with vans and sometimes with buses, but I have seen a lot of windows open as well. And I don't know, the 6 foot separation doesn't seem to be occurring that much from what I've observed. But I do see people with masks on. I do see the windows open. So that's what I see being done, whether it's, you know, right or not.
Well, we don't have any very much carpooling or in large groups, but one of the things that I believe, and David, please correct me if I'm wrong, we are allowed to create cohorts. So if you can, for example, put 3 or 4 people together as a team, and they're always riding together, and they're always, you know, hanging around, then probably, you know, that will kind of a little bit eliminate some of the risk. But if you have somebody that jumps in one car and then next time jumps in the other car and then rides with somebody else. So if you can put them in the groups of the people that always stay together, I believe under under governor degree and the explanation, you can create this cohort type of a system when that allows you to have a little bit less of these requirements. But Dave, am I correct about that?
Yes, yeah, you're absolutely right on with that. And that a lot of that came from the temporary worker housing rule. And that's where if you can create work groups where people are staying together, you know, in this case, they're staying together, they're living together, they're pretty much doing everything together. But that same concept applies to say a work group. If you've got these people that are just exposed to one another, then you can do that. And so we are seeing that where you have created these cohorts, they can ride together. It's a little different outside of the temporary worker housing situation because when they're not, you know, again, when they're on their own time, you don't know what they're doing. So again, screening becomes really critical. But yeah, you're right on with that.
Anybody else have other questions? Or comments?
I think one thing that came up in some of the other meetings I watched were what are the agencies that are providing the information? Who should you listen to, and how do you keep up with all of it?
Wow, that's a loaded question, but I'll tell you what, I get that, and the sources of information right now are many and varied, and they're all over the place. I mean, you'll see stuff from the governor's office, you'll see stuff from L&I, you'll see stuff from the Department of Health. You know, who should you listen to? Again, everything that is a requirement is coming from the governor's office, and then it kind of goes from there. Now, again, the governor is pretty much following, you know, science, and they're following the CDC guidelines. So really, whenever I have a question and I don't know the answer to it, the first place I go is the CDC, because that's the best source of actual information. And then I would check the governor's list. And then the periphery agencies like Department of Health, L&I, all of those things, we all have different pieces of the pie essentially that we're in charge of. So, you know, we're getting all of that from the governor's office. So really your best source is again, governor's office, CDC kind of right together are going to tell you the requirements that you have to follow. Yeah, that would be my advice.
Matthew, can I share my screen? I'm sorry, Carrie, I didn't mean to cut you off. Can I share my screen really quick and I'll show you my website where we've tried to aggregate some of those things so that it's not quite as hard to, because you got your day job to do, right? So from here, like, again, you're going to see this broken down by who it's coming from. And then, you know, essentially we've tried to put the most pertinent, if it's coming from a federal agency, you know, we have all of our guidelines up here so that you can find them, you know, like right at your fingertips. And again, this is on our food safety webpage. Here's the COVID, if you want to get to the Q&A, that's right here. And then this is under our resource list.
Is there anything coming out of like county offices, the county health departments and things like that that would be different than what we would be hearing from the governor's office and other places?
Well, Carrie, just because I am in Grand, Franklin, Benton, you know, Umatilla, Morrow, all this stuff, on the beginning of this process, you know, it was so hard because I was just fishing for information going everywhere. But yeah, pretty much FDA, CDC kind of a thing. Now that the governor stepped up and started releasing some of this information, I look for that. And then L&I or other state agencies. But what I found out from local health departments, they usually don't have anything different. They either repeat what the governor's office says, or they may have some specific information about local situations, but in the sense of the instructions, what you're supposed to be doing and how you're supposed to be doing, it doesn't really changes.
We have other questions. Carrie, did we knock your questions out?
I think we got, I did write a few more down and some people had sent in. I think we pretty much got through most of that. There's one little thing about the sensitivity of different type of we kind of touched on it, temperature taking instruments. And we talked about some issues sometimes with accuracy of that. I know Faith had talked about the no touch.
Yeah, and so if you've ever used an infrared thermometer for checking like product temperature, if you're trying to cool stuff, then these are the same sorts of thermometers we're using, and they're not, as Marcin already mentioned, they're not extremely accurate. The things that tend to throw them off the most for people is if somebody's in like a line getting ready to have their temperature taken and the sun's beating down on them, that's going to drive their skin temperature up, right? So they may, as he was saying, that's a good time. I like that protocol of like sending them back to their car and having them wait. Some other facilities try and, you know, deal with that. If it depends upon the number of people that are all showing up at once, right? If you have like 10 to 15 people, maybe this is doable. If it was like 60 people, it's probably not. But some facilities were screening people in the cars as they were entering, so they didn't really have to deal with outside throwing loops and things. And basically just know that these infrared thermometers are gonna wear out pretty quickly, especially if they're being used every day. So have them, it's like with anything, I would probably err on getting some that are kind of in that medium range, and then have backups of backups so that you're not scrambling trying to find them, because it's not going to last for forever. We're seeing people already run through them after, you know, a month or two of regular use. And yeah, you can speak up to Marcin.
Thermometers. So first of all, let's be honest. If somebody has a normal temperature of 98 degrees, and then you worry if your thermometer is accurate to show that they have a fever, that's 2.5 degree difference. You know, if somebody has a fever, you will know they have a fever. And if you have a question about your thermometers, it's simple. You take it home, you take the regular thermometer, your kid's thermometer, you put it in your mouth, you measure your temperature that way, and then you shoot yourself with your, you know, infrared thermometer. And if they're close enough, that means your thermometer works good. If it's not, then yeah, it's time to go get by yourself another one. And in our operation, I think I am 10, I think purchased 10 or 11 thermometers, and I just heard that 2 don't work. So I'll be going out there and buying more. But there's one thing. The first ones I bought cost me $98. Right now, I can probably get them for 35 bucks. So, you know, again, there's some good things happening, and in thermometer, one doesn't work, get another one. It's, you know, it's small investment. And so that's important. But generally speaking, I have 2 thermometers. If somebody has a question, if one works, there's another one. You don't believe this one, take the other one out of the box.
Do we have another question? Or any discussion? Are there any final statements?
Well, I'll make my kind of final pitch. I have to kind of make my final pitch basically. So I know, you know, just me sitting here, and I know that as Matthew introduced me, you know, I'm from the State Department of Labor and Industries. I can kind of be seen as the government guy, and everybody's a little leery about L&I. So I just want to explain a little bit, and you may already know this, and so I just want to put you at ease if I can. So if you think of L&I, what we are, the Department of Labor and Industries, and we love our acronyms, and so you hear DOSH or you hear WISHA. WISHA is the actual act, DOSH is the Division of Occupational Safety and Health. We're the Washington equivalent of OSHA. So within DOSH, we have 2 sides of the house. We have compliance and we have consultation. Everybody's familiar with compliance. If you as an employer, if you are found to have a violation, they'll send an inspector out and you can be fined, penalties, citations, you know the drill. And so everybody knows compliance. My side of the house is consultation. And with consultation, what we do is essentially we all work from the same rules. And so I have consultants that deal with safety, things that can hurt your employees, and health, our industrial hygienists, things that can make you sick, like COVID-19. And then I have risk managers who deal with claims management, industrial insurance, best practices, HR kind of stuff, that type of thing. So I'm in Region 1, which is Skagit, Snohomish, Whatcom, Island, San Juan counties. I'm a Skagit Valley kid. I grew up in Mount Vernon, grew up on a farm up there, so I'm really familiar with the area. And what I do is I manage a group. I have consultants in Everett, Mount Vernon, and Bellingham. And our consultation services, here I'm going to put if I can get this to work here, I'm just going to put it up in the chat box. If you click on that link, it'll take you to the L&I page, basically, that explains what consultation is and the services that we can provide for you. And so, because what I will say is, again, 2 sides of the house, compliance and consultation. And there are times where compliance is obligated to visit you, to come out. And that's really 3 things. If you have an employee that is hurt and it requires a hospitalization, L&I will send a compliance officer to investigate that and see what happened. If there is a complaint, so if your employee calls L&I and complains about a safety and health concern, and then L&I will send a compliance inspector out to investigate that complaint to see if it's valid. And then you have what is called a referral, which is where a member of the public can call up and be anonymous and say, hey, I saw this. I think you should go out and take a look at it. And in many cases, L&I will have to send a compliance inspector out to see if there's a valid violation, essentially. So that's kind of the one thing. So there's really 3 instances where L&I will show up and you could get a citation or a penalty if there's a violation that's found. With consultation, and again, if you think of compliance really represents worker safety, consultation also does, but we approach it from a different angle. We work with employers, so for you to want a consultation, you would have to request it from me or another consultation manager that you actually want some help. And then we would come out, and again, there's no charge for our services. We do not issue penalties, citations, or fines, and there's a one-way mirror. I can see everything compliance is doing, but compliance can see nothing that I'm doing in consultation. So our services are confidential to employers as well. So all of that to say, the best thing you can do, if you want some information about what kind of services L&I can offer you free of charge to help, click on that link and it'll give you really all the information that you need, and then all of our contact information will be available so that you can contact us. What I've told the berry growers, what I've told the grape growers, what I'm telling the potato growers, what I'll tell anybody that will listen in agriculture is we are in uncharted territory right now with COVID-19. And we've always been here. We want to provide a resource to help you, and now more than ever, we want to be able to provide you a resource to help you. So please don't be afraid of reaching out to L&I and asking for help, because we want to help, and we understand there is nothing that could be more devastating to you as a producer to have something in the middle of harvest shut you down, whether it's a COVID thing or whatever it is. And that's my plea to you is I exist to help you keep your people safe and stay out of trouble. So that's why I'm here. That's why I'm really glad Matthew invited me. That's why I'm really glad we're getting out into the agricultural community and letting everybody know that, I know that the initial thing is to just be scared. No, we don't want L&I coming in. We don't want you looking at anything. We don't want you to know what we're doing because you're the government, and we're the government and we're here to help. Yeah, we know how far that goes sometimes. So all of that to say, please, if you have any questions, feel free to reach out to me. Click on that link. We're happy to help if there's anything we can do. And with that, I'll let somebody else give their final statement. But that's all I can tell you from my perspective. And I really appreciate you guys allowing me to be part of this and give you some input.
David, thank you. That's very reassuring.
Yeah, and I'll just say, by all means, reach out. I'll put my email address down here in the chat box. And I would say also that you all will come up with really inventive things. And the more that you can share as a group, I think that it's nice amongst yourselves, because you're all encountering very similar things. And while it's kind of operation specific to a certain degree, there's a lot of things that you can help each other with, as far as this worked well for me, this didn't. So I think that that's another really good way to kind of start bouncing some of these things off of each other if you're running into issues.
Well, my last comment would be I wish our industry, it's agriculture, but it's a little bit different than the apples and the grapes. So any ideas that people come up and willing to share, I can, it's kind of I'll say, for example, I know very well that the chocolate syrup pumps that you can buy in the restaurant supply stores works really good with liquid soap if you cannot get the official dispensers. And for example, the one that dispenses a coffee creamer works really good with a gel sanitizer if you have it. So we have come out ourselves with two or three simple solutions to the problems that we had. Disinfecting wipes coming without the dispensers, how you're going to dispense them when they're coming, basically in a plastic bag with a liquid in it. So again, going to a plexiglass for the people in the packing houses, you guys getting all these boxes with a very thick plastic, shrouds on them, they probably work really good if you have to put the quick barriers on the inspection table, hang them. No, you cannot see your buddy across the table, but there is a barrier. It doesn't have to be a plexiglass. So there's a lot of smart and quick solutions that we can come up with, but what's important that we're going to share with everybody else.
Thank you, Marcin. Does anybody have anything else they'd like to say? I think we'll go ahead and close there then. And I just want to thank Faith, David, Marcin, Carrie, and Tim. And this is for you. Thank you.